This month on The Spark, our theme is looking out for public health. We'll learn more about an organization helping to make Memphis a more sustainable community through the power of composting. A doctor and team using a localized approach for pain treatment with trauma situations in order to reduce suffering and exposure to opioids. And a Memphis-based company delivering disease prevention by providing orally delivered vaccines to address the world's great health challenges. We'll also share a special moment from our Spark Awards 2019.
Lipscomb and Pitts Insurance is honored to serve the Memphis community for over 60 years. We've always focused on supporting our community and believe in promoting the positives, encouraging engagement, and leading by example. Lipscomb and Pitts Insurance is proud to be a presenting sponsor of The Spark.
Additional funding for The Spark is provided by Christian Brothers University, Mueller Industries, YMCA of Memphis and the Mid-South, Meriton, United Way of the Mid-South, MyTown Movers, MyTown Roofing, MyTown Miracles, Stuart Lloyd Cohen, Chief Motivation Officer, and by Serves.
Ever been excited by a new idea? Inspired by watching someone lead by example? When we talk about creating change, we start by sharing the stories of everyday heroes making a difference in their own way so we can learn and do the same. This truth is the power behind this show, which is focused on business and community leaders who are leading by example to give back, fuel change, and create new opportunities for the Mid-South. I'm Jeremy Park, and this is The Spark. They're an organization helping Memphis and the Mid-South become a more sustainable community through the power of composting. Compost Fairy with Mike Larrabee and Caroline Norris. And start with, when you talk about the organization, give us a little bit of history and then we'll dive into the power of composting.
All right, real quick. Started composting when I was a kid. Moved back from Europe about 7 years ago. Bought a house and I was not paying for dirt. We just don't pay for things like that where I'm from. So I made an ask in the neighborhood. Neighborhood exploded with responses. So we got all we needed and didn't want to discourage that practice. So we started with the community association, a drop at the farmers market, also to drive people to buy local food. Very quickly grew past that also, and formed as a 501c3 in October of 2017. And it's been off to the races since then.
Well, and you make it very easy for both the homes, the residential side, and the businesses. So talk about kind of how Compost Fairy works.
Sure. Well, I mean, we have lots of programs. The top tier goal is to divert stuff from the landfill where it causes a disaster, and also to provide that material back to local agriculture so that they can own their fertility and produce more nutrient-dense food at a lower price point. Public health for us, right? Also. But we do a residential curbside collection. We do commercial collection for restaurants and businesses, office parks, like on a huge scale. Indigo Ag is 450 people or something like that. We do them every week. Just rolled Central Barbecue, so like we're really starting to put some numbers up. And also we formed as a nonprofit for several reasons. One of those is to provide a pay barrier-free access for the 30% of our population that doesn't necessarily know where dinner is coming from tonight, so it's not very reasonable to ask them to pay even a little bit to take the food away that they didn't eat at dinner.
Well, and so going back to your original point, this is keeping materials out of the landfill, and it's huge numbers that are adding up there. It's reducing the carbon footprint. There's a lot of society benefits. Walk us through some of those, because like I said, the numbers are starting to get really big.
Oh, for sure. So last year we diverted about 2.5 million pounds of food waste, which is significant.
But the average household, how much does that average household create? What kind of waste?
So Memphis is a little bit higher than the national average. We're around 1,800 pounds a year per person, every man, woman, and child in the community. And about 250 pounds of that is food waste. So you can take that out of the waste stream and get it out of the landfill immediately. Our market data indicate that we can probably divert 250,000 tons or yards of organic waste from the landfill and put that back out. And the big deal about that is 20% of all the methane that's produced in America is the product of organics breaking down improperly in a landfill. Methane is how many times more?
84 times.
84 times more
potent.
than the carbon that comes out of the tailpipe of your car. So you're not only putting that stuff back to work as a carbon sequestration device in local sustainable agriculture, you're also taking all of that methane generation out of landfills.
And that was what was really most impactful to me. I don't know a lot about sustainability. I was just trying to do a little bit at a time, like, oh, I'll recycle my plastics and I'm doing a great job. And when I started learning about composting and that all of my food scraps, everything that I'm cooking with, that all of that can now be composted. My trash, my landfill went from a bag or two a week to I have to take it out once a month because it's been sitting there for like this much has been sitting there for a week. And so those are just some small things that if we all did that, I'm not maybe making that big of an impact, but I'm doing my part. And if we all did, and that's why Compost Ferry makes it easy, because we just provide a bucket and you just put it in the bucket and the ferries drive around and scoop it up.
Yeah. Sure, because anyone, you empower others to compost on their own terms. What you have, though, is a high-powered kind of mechanism to do this. So in other words, when you talk about your ability to do this, there's a certain level of heat and things like that go in. There's a science to this.
There is, yeah. I'm a geologist by training, but I have a background in ecology and soil science specifically. So we do tremendous volume. And it's much easier to create a higher value thermophytic compost where that threshold gets higher. We get to actinomycetes, which makes a really polished, nutrient-dense compost. And also, we're an industrial facility, so we have entered into a partnership with the city of Memphis, wherein we are permitted to take cooked foods, post-consumer stuff, meats, bone, fish, cheese, all of that stuff, as well as compostable products. So like a cup that's certified compostable that's made out of like corn sugar or cane sugar or something like that, that is a much more sustainable alternative than petroleum plastic. And there's a huge boom in that stuff going on right now because the cat is out of the bag with plastics recycling. And 9% historically of plastics that have entered into the waste stream are recycled. The rest of it winds up either in a landfill or back out in the environment. We recycle food waste, and 100% of what you give us is recycled and put right back out into the world where it can go to work and heal the soils and help farmers and do all sorts of things all at the same time.
Well, where do we go to learn more?
CompostFerry.com.
That makes it very
easy.
For sure.
CompostFerry.com.
Yeah.
Well, greatly appreciate all you're doing, not only to make it easy, but for the greater good of our community. So thank you for coming on the show.
Thanks for having us.
Appreciate it.
They're using a localized approach for pain treatment with trauma situations. We're here with Dr. Jerry Jones. He's with UT Health Science Center and also Regional One Health. And let's describe, because you have a lot of different roles, so let's start there with a lot of different roles, and then we'll dive into what you're doing, which is fighting the opioid epidemic, which is amazing. So give us some of your different roles and hats that you wear.
Okay, well, just basically, I'm an anesthesiologist. I'm the guy who you meet before surgery, put you to sleep, keep you safe, try not to knock your teeth out, don't kill you, make sure everything's okay, and get you out into the recovery room and on. So that's kind of the regular role. But I have gotten into a subspecialty of anesthesia, which is this acute pain management. So we try to not only keep people safe and unaware, we're trying to keep them from hurting so much. So this subspecialty has emerged in the last decade or so, where we're really focusing on improving pain, avoiding opioid exposure, and then even taking that care farther after surgery or after an injury. So I'm the director of the acute pain service at Regional One Health and the division chief for regional anesthesia and acute pain medicine. And I hope very soon to be the program director for a fellowship in regional anesthesia and acute pain medicine in the summer of 2021.
So you kind of alluded to it, but this is a different approach. So this is using a very localized, specific approach versus kind of a broad blanket with the opioids. And so we'll talk about why that's so important, but describe kind of your strategy and your philosophy and kind of what you're doing here.
Okay. Well, opioids will probably always have some role, but instead of it being opioid monotherapy, only opioids as much as possible, we want to cut that as much as possible. So everyone says they're scared of needles, but we do use, we numb the skin and use a needle to go to a particular place. It might be next to a nerve or in a particular zone between muscles. And now that we have ultrasound technology that's so much better, it's opened the doors to so many more opportunities. So it's easy for us to find a particular place, put local anesthetic in a specific place to make that area numb. It's essentially the same as with the dentist. You know, they give you a shot here and you're numb around. But now we can do that just about anywhere on the body. The thing that's really made the difference, though, if we just gave you a nerve block and you say you're going to be numb and comfortable for the next 18 hours, well, 2 o'clock in the morning it wears off and everything's terrible. Now, because we have ultrasound and all these other, maybe the technologies and techniques and things, we can go to that place, wherever it happens to be, make you numb, and we slide a tiny little catheter. It looks like a fishing line. We tape it down, and we infuse numbing medicine for however long you need it. So a thing that's going to be terribly painful for 3 days, 5 days, 7 days. At the trauma center, we have a lot of rib fractures that come in from all kinds of different reasons. And rib fractures, they hurt like crazy, and you can't hold it still. You've got to take deep breaths and cough, or you'll get a pneumonia. You'll end up on the ventilator. It's not going to go away tomorrow. So we figure out where the ribs are broken, for example. We put numbing medicine in those places and we infuse it. Patients are wide awake. They're actively involved in recovery, so they're taking deep breaths and coughing. They're not getting constipated and nauseated or confused from narcotics. And then we just keep them numb. As best I say it's like a parachute. We try to make the parachute take you all the way to the ground. And then when we see that there's not much pain left, everything's okay, then we can pull it out.
And talk about why that's so important, because with opioids, it doesn't take much to get the effect to where ultimately you can become addicted. And that's the danger zone. So I mean, when you talk about kind of maintaining that and controlling it, that's why this is so important.
Right, so everyone knows that there's sharks out in the deep water, but the sharks are in the water where it's ankle deep. And that's the same thing with opioids. People will say, well, like, I'm not gonna get addicted, I would never want to. Yes, some people try to use them recreationally and that happens, but we don't know who it is. I don't know if it's me, my daughter, you, your family. I don't know who that is. I can find risk factors for certain people, but just exposing people to opioids for 1 week, I mean like a hydrocodone or something after a minor procedure, if you have that exposure for a week versus the same procedure and you don't, you're 44% more likely to become a long-term user. Right now, over 40 million patients are going to have surgery or going to have trauma, and they're going to be exposed to opioids. Approximately 6% of those patients are going to go on, and this is 2.5 million people, are going to go on to be long-term opioid users, and some percentage of them are specifically going to have opioid use disorder. So to me, it's just an exposure issue. I don't know who all the people are, and it's not so easy to figure out. So my approach is don't expose anyone to even one pill if they don't have to have it. And we have things that are so much more effective anyway. They don't come with all these other side effects and problems.
Yeah, and that's to your point of even coming on the show, is to become an evangelist saying, hey, there are other ways to do this, and just getting the word out. And so what would you hope to encourage viewers in terms of just knowing that this is an option?
Right, well, I think that's, and thank you for the opportunity to kind of spread the gospel. The first thing I would want every patient out there to know, you or your family member, your children, your grandparents, whoever, you don't have to just go in and hurt like crazy, and you don't have to go in and get, schnockered with a bunch of opioids and get constipated and confused and leads to other complications and possibly addiction. We have all kinds of ways. So even just conservative things like making sure that the surgery center or the hospital that you're going to practices with multimodal analgesia. That is, there are guidelines now, like I said, that show us you should schedule Tylenol to patients who can receive it, or non-steroidals and other things. Look for places that offer, because one of the biggest parts of multimodal is this local anesthetic with nerve blocks or continuous infusion. Look for places that offer that, basically pressure facilities to accept the new way we should take care of it. The status quo is not going to change by itself.
Where do we go to learn more? Websites, where do we go?
Sure. The foundation is regional1health.org/foundation. There are patient stories, and you can see, I think there's 8 or 10 individual patient stories. The American Society of Regional Anesthesia, ASRA.com, they have patient information, so people want to understand more about what is a nerve block, what is a continuous nerve block, how should we do these things differently. There was a summit held in August of this year through the University of Tennessee, SOAR, the Summit on Opioid Addiction and Response, and that's at tennessee.edu/opioid summit. If you want to look at not just what I'm talking about, these techniques, but we looked at an entire societal view of this opioid crisis. It's not a minor issue. I mean, looking from the legal aspects of it to the costs and all kinds of other things. All of the lectures are actually there. You can watch them. I actually have one on there where I talk in more depth about these sort of things.
Well, I love the fact that you put it all out there. You make it very, very easy. And like we said, knowledge is power. So thank you for coming on the show. Thank you for all you do. The Spark Awards annually recognize and celebrate individuals and organizations that have made outstanding contributions to the community. This year's recipient of the Individual Collegiate Award is American Cancer Society volunteer Edgar Cruz.
My name is Edgar Cruz, and I'm currently a medical first-year student at the University of Tennessee Health Science Center. And I recently graduated from Baptist College of Health Sciences, where I was the president of Colleges Against Cancer there, and I was the founding president. I founded it my first year in 2015. If it wasn't for the help that I got from my friends there and also the support I got from the American Cancer Society, I would not have been able to establish that at all. College Against Cancer, that is a national college organization. What we do is that we try to take part in each of the American Cancer Society's events, so Relay for Life, Making Strides Against Breast Cancer, and also come up with our own events. We try to make a difference here, at least locally. My work with the American Cancer Society, it all started off with my uncle died of colon cancer in his mid to late 30s. That really affected me as a child because that was the first time I ever had to deal with a real medical issue. And that's really what really got me interested into cancer. But I didn't know I really wanted to go into medicine until my mother suffered from a fractured tibia. That's where I really started to get an interest into medicine because she was treated at Baptist Hospital here in Memphis. And I was just overwhelmed by all the support and care that she received from the physicians and all the other healthcare professionals at Baptist Hospital. Once I finished high school, I was looking to do some community service here in the Memphis community, and hopefully it's something to do with medicine. I looked online and saw that the American Cancer Society office here in Memphis was in need of office assistant, so they took me on as an office assistant, and I've been going weekly since up to this day. Relay for Life is it's now a worldwide fundraising event where all the money that's raised is directly invested into cancer research and cancer support programs. And we do see a lot of the money here in Memphis. Even at our local office, we offer free wigs for people who are going through cancer and would just feel a lot better with the wig. So we offer lots at the American Cancer Society, and I feel so grateful to have been a part of that. I feel as though that I would like to do something in primary care because I believe prevention is the best form of medicine. Because a lot of cancers nowadays can be prevented through good care. So if I can do that, if I can prevent cancer from ever becoming an issue in the first place, I feel like I would have made a difference in the world. I've just been blown away, like all these people each person has their own story, and if I'm able to help them, that just makes my whole day a whole lot better. I'm just happy if I can help them at all in any way.
They're a company addressing some of the world's greatest health challenges. We're here with Mason Kaufman. He's the president and CEO and chairman for US Biologic. Let's start with a little bit of context for US Biologic and then also talk about why Memphis, but then we'll dive into all the good that you're doing, the innovations. But give us a little bit of history for US Biologic.
US Biologic started in 2012, and we had a vision to eliminate diseases. And we have the technology here at the University of Tennessee Health Science Center, and we have a wealth of, when you look at Memphis, just our healthcare infrastructure, it is really world class. And if you didn't know, healthcare represents 17% of GDP, so 17% of everything we spend. And then as far as the logistics infrastructure in Memphis, that's 8% of GDP, and we also have a touch point in the agricultural market, and that's 5%. So if you combine those, that's 30% of everything we spend in the nation. So Why not Memphis? Absolutely Memphis. I can't imagine a better place.
So let's talk about what you do and kind of the first step of this. Zoonotic diseases is a big starting point. Describe what zoonotic diseases is, and then we can dive into what you're focused on facing.
Oh, absolutely. Zoonotic diseases are diseases that come from animals, which is 75% of all infectious disease we get. A lot of people might think we'll pass a disease back and forth, but that's pretty rare. More often than not, it comes from an animal. One of the things that's in the news this week is coronavirus, and that'll continue to be an issue. You have rabies, you have Lyme, you have Ebola, you have Zika. Those type of diseases we understand, and we can prevent those.
Talk about kind of how you're combating Lyme disease, which is, to me, really fascinating.
Well, it is too, and my background was in business, but now that I'm involved more in the science and have a team of just really stellar scientists, I couldn't be more excited about doing this mission for my last career. And so specifically with Lyme disease, people know that you get Lyme disease from ticks, but a lot of folks might not realize the ticks get the disease or the bacteria from mice. So that's the supply chain of Lyme disease. It goes from mice to ticks to people. So we have a technology, we have a little vaccine pellet that if you put it out in wildlife, the mice consume the vaccine pellet and it just stops the disease transmission right there. Because if the mice don't have the Lyme bacteria, then they can't pass it to ticks, and then subsequently a tick can't pass it to humans or pets.
And I think that's kind of a really interesting innovation, is instead of attacking, okay, we've got to find a cure for Lyme disease, which is obviously still, we've got to still do that, you're attacking it right at the source to be able to wipe it out from the get-go.
Absolutely. And it makes it so much more cost efficient. Instead of playing defense, trying to protect everybody at the tail end, and at the same time, the Lyme bacteria continues to rage in the backyards and the public lands and the playgrounds and sports fields, we go, like you were pointing out so rightfully so, right to the source, cleanse the bacteria out of the environment. Kind of like if you took Perel on your hands or Lysol on a kitchen counter to take away the disease-causing bacteria and viruses. That's what we do.
You've got government side on one piece, you have the private sector, you have residences, so there's a lot of different layers in terms of rolling this out. Share the rollout.
Great question. When you're doing a disease prevention program, and again, that's where not only the biology, but the logistics comes in place. So biologistics is a term you'll hear, and that's what we're very good at. So if we're doing residential properties, we know that we want to work with partners like Terminix or TruGreen or lawn and pest management folks, because they're already in millions of homes, literally, and they're looking at not only controlling pests, but also obviously controlling disease. And if we can partner with them, I can't imagine a better way to do home distribution. Now, at the same time, with states and federal lands, you also need to protect parks like Shelby Farms or the riverfront here. And so we can take those same pellets and we can distribute them around Hyde Lake at Shelby Farms or around the playgrounds or around stables, and protect people both when they're out at public properties and then when they're at home at their own residences too.
What's the projected timing in terms of kind of rolling these out in phases, and give us kind of the game plan?
Well, what we're doing in 2020 is we're focusing on our product approval. Our agency that oversees this is the USDA, and they're great. Can't say enough good about them. And so we're in the final stages of going through their process, and they'll be the ones that ultimately say when we can distribute the product. But we would hope it would be, later this year, certainly next year. And so once we're distributing the product, then we work with those partners we shared earlier, and that will be our time frame. And so ready to go in 2020, continue to expand in 2021, and then the market for Lyme disease specifically is even larger in Canada and in Europe.
So on your end, talk about website, where do we go to kind of stay in the know and to be in the loop, because you even have technology that can figure out kind of geographically where hotspots are. So you have a lot that goes on. So share a little bit of teaser on that, and then talk about where we can go to learn more.
Okay, well, two websites. One is usbiologic.com. That's our core website, and that's going to talk to you about our Lyme prevention. It's also going to talk to you about our expanded oral vaccines. we can actually provide oral vaccines not only for wildlife like mice, but also for companion animals like dogs and for livestock, poultry, different animals like that too. All very exciting. So I'll come back and talk to you more about that. But then when you mention about us being able to predict where disease is, we actually have another website that you could visit called zoohub.org. And that actually takes you to our application where we're able to predict where diseases are moving. Similar to a weather application, you can go to our application and see where Lyme disease or other diseases are going. And if you say, which is more important to me, knowing weather tomorrow or where a dangerous area might be with a zoonotic disease, I think the zoonotic disease might trump that, albeit both are important.
Yeah. Well, I love, like I said, the innovation of this and what it means not only for fighting Lyme disease, but really for zoonotic diseases in general, of going straight to the source. It's extremely powerful and exciting and inspiring. So Mason, thank you for all you're doing for coming on the show.
Thank you. Appreciate your interest.
As we saw in this month's episode, we're fortunate to have individuals and organizations here in our hometown who are working hard to tackle some of our world's most challenging issues, like the opioid epidemic, Lyme disease, and environmental sustainability. Dr. Jerry Jones and his team are taking a localized approach to help trauma patients manage their pain while avoiding the use of opioids and avoiding the risk of addiction. Knowing there are safer alternatives is powerful knowledge for you and your loved ones. Then to have U.S. Biologic paving the way to address Lyme disease by attacking it at its source is both innovative and a big opportunity for us to protect our families as we play and enjoy the outdoors. And having the compost ferry to reduce what goes into our landfills, reduce our carbon footprint, and empower composting and reforestation helps protect our environment and ensure we have a bright future ahead. When we have individuals and organizations looking out for public health, we're all better for it. So thank you for watching The Spark. To learn more about each of the guests, to watch past episodes, and to share your stories of others leading by example, visit WKNO.org and click on the link for The Spark. We look forward to seeing you next month, and we hope that you'll continue joining with us to create a spark for the Mid-South.
Lipscomb & Pitts Insurance is honored to serve the Memphis community for over 60 years. We've always focused on supporting our community and believe in promoting the positives, encouraging engagement, and leading by example. Lipscomb & Pitts Insurance is proud to be a presenting sponsor of The Spark.